Welcome to the Group Dentistry Now Show, the voice of the DSO industry. Kim Larson and Bill Newman talk to industry leaders about their challenges, successes, and the future of group dentistry. Visit groupdentistrynow.com for more DSO analysis, news, and events. Looking for a job or have a job to fill? Visit joindso.com. We hope you enjoy today's show.
And I'd like to welcome everyone to the Group Dentistry Now Show. I'm Bill Newman, and we always have interesting guests today. This is a little bit different because we're typically talking to CEOs of DSOs, or we're talking to vendors that sell product to DSO, but this is actually great because we're talking to a clinician that got in relatively early at a DSO, and we can talk a little bit about his experience, why he chose to work at a DSO, what the benefits are, really how it's helped during the COVID crisis, what he's seeing in his locality with other clinicians. So without further ado, I'd like to introduce Dr. Blair Brown, and I'll give you a little bit of his background. So Dr. Brown was born, he's actually a Canuck, so he was born in Lethbridge, Alberta, Canada. He received his Bachelor of Science degree in chemistry from Brigham Young University, and then moved to Louisville, Kentucky to attend the University of Louisville School of Dentistry. Dr. Brown has been with Mortenson Family Dental, a member of Mortenson Dental Partners, and we'll talk a little bit about that, since he graduated from dental school in 2009. He and his wife, Laura, have 5 children: Cami, Noah, Allie, Ryan, and Lily. When not seeing patients, Dr. Brown enjoys playing with his children, camping, fishing, cooking, barbecue smoking, that's big in Louisville, and watching movies. And right now, I guess you're also enjoying some homeschooling with the children.
Yeah, the kids popped in a little earlier before we started recording, but they're doing homeschooling right now. So all 5 of them are at home.
There you go. So if you hear anything in the background, you know it's the kids studying.
That's right.
So welcome, Dr. Brown. Appreciate you having you here.
Happy to be here.
So tell us a little bit about Mortenson Family Dental and then Mortenson Dental Partners, and maybe the difference between the two.
Sure. So as you mentioned in the bio there, I graduated from the University of Louisville in 2009. Kind of during my junior year, I had looked around at job opportunities, things like that. And I knew some of the Mortensons already. One of the Mortensons was one of my classmates, Mark Mortenson, and his uncle is Wayne Mortenson, who had started the company. So they were on my radar, but I really didn't have plans to necessarily join the group. And at that time, it was just Mortenson Family Dental. It was pretty much regional to Louisville and parts of Indiana, where we had multiple practices. And it's obviously grown since then to other regions. But I was looking to join a DSO or some sort of group. I could see the writing on the wall was towards group dentistry. And so between my 3rd and 4th year, we do an externship where you go out on your place with the dentist and you work for about 4 or 5 weeks, and then go back to the school and to kind of give you an experience of what it's like to practice dentistry outside of the school setting. So I purposely chose to work at a group in town. It wasn't a Mortenson group, but it was a group setting. And the dentist who kind of mentored me really strongly advised me to consider that as a job opportunity. He had been in private practice for quite a few years and had struggled. I mean, he never was bankrupt or anything like that, but had struggled to be really financially successful. And then he decided to join this other group, and he said it was the best decision he ever made. So that kind of furthered my idea that group dentistry might be something I'm interested in. I came out of school with huge student loan debt, as a lot of newer grads, and it's even worse now. It's about double what I came out with now that they're graduating. And to go out and buy a practice, I also graduated right after the huge 2008 economic downturn. So the idea of borrowing money to buy a home, borrowing money to buy a practice, and all of these things when my skill set and experience was zero seemed daunting. And so I wanted to join a group. I kind of was hesitant to approach the Mortensons because I knew them personally. I didn't want them to think they had to give me a job because we knew each other, and I went to school with his nephew. And so I started looking outside of Louisville, and we really liked Louisville. My wife's from Kentucky, and her family was nearby. So she said, well, we should consider it. You need to talk to the Mortensons. And so I reached out to the director of HR, just inquired, and they said, you know, we're not hiring right now. And I said, okay, that's fine. And then he told Dr. Wayne, and then Dr. Wayne personally called me in and interviewed me, and he said, I don't want you to think that this is a charity job or a pity job or anything like that. I've been following. I was surprised to know how much Wayne knew about me actually in dental school, because I didn't know him all that well. But he said, we'd love to have you. I think you'd be a great fit. And so we made the decision to stay in Louisville and join Mortenson Family Dental, which at the time was the entire company. Since then, we've expanded into other regions in an effort to allow the other regions to maintain the goodwill and name recognition that they've built up over the years. We created the Mortenson Dental Partners, which is the larger group now that Mortenson Family Dental is a part of. So our local offices are all branded Mortenson Family Dental, or our specialty practices are branded accordingly. But the other regions, for example, in Utah, we have Stonehaven Dental. That was something developed by the Toblers, and it had been there for quite a while. We didn't want to lose the goodwill and the name recognition. And so when they joined the group, they maintained Stonehaven Dental as their practices, and that's what it still is, but it's part of the larger DSO, which is now Mortenson Dental Partners. And so that's been around for 5 or 6 years. You know, the executive team could correct me on the exact date on that, but so now it's a larger group that can go into multiple locations, and we can welcome other groups in the future that don't have to completely give up what they've built over the years for their local recognition and their goodwill for their patients, because they can just get folded into the greater whole of Mortenson Dental Partners. So it's worked out really well for the expansion model, and I think it centers around the idea that we're asking people to join our group to help get managed and do all the wonderful benefits that come with a large DSO like we have, without completely giving up their autonomy and the things that they've kind of built over the years. And so that's kind of how we got where we are. And I've kind of seen that. I served on the board of directors for 3 years, from 2012 to 2015, during when a lot of that transition happened into the regional markets. And it was really interesting to see Dr. Wayne's vision and the other executive leaders to do that. And I feel that's mirrored at the local level, where even though I practice for a large group, I still feel like my local office that I work at, I'm the only dentist at my location, I still consider that my practice. I have large degree of autonomy of how I treat patients and what I do, the materials and supplies that I use, but I have the support of the larger group to help me with management decisions, hiring, HR, things like that.
You know, that's great. So you really have been there from, you know, the earlier times, and it makes sense to have that local branding in the market where the patients still, you know the brand, and also just gives you opportunity to really be tied to the community as well.
That's right. Exactly.
Well, good. So let's talk a little bit about, and I hate to do this. I've been doing this since the middle of March, but we'll have to talk a little bit about COVID. One day, hopefully we can talk about it in past tense, but right now,
that's right.
you know, being part of a DSO, obviously, and being in the dental industry has been a huge challenge during COVID. You know, we were all of a sudden ran into this time frame in from March until, it depends on where you are in the country, that there was essential dentistry and non-essential dentistry. And so that was certainly a challenge, trying to figure out, well, what's essential, what's non-essential. A lot of times it varied. So talk a little bit about you personally, and how working at a DSO really was a benefit to you during the COVID crisis.
Sure. The number one thing for me personally, and this wasn't true for every practice in our region, but we had to close down some of our practices because we knew the patient flow would drop, quite a bit. And so they chose about 1 in 3 practices in our region to stay open to see emergency patients during the shutdown. And I was fortunate to be one of the practices chosen to stay open. So I've never closed. In fact, a lot of patients keep coming in, how did you manage when you were closed down? I said, well, we never closed down. We saw emergency patients the whole time. The way they made that selection was, one, geographical. They also took in the skill set of each provider who could do the most type of emergency dentistry in a short amount of time. And then risk factors. I didn't fall into any of the risk factor boxes, age-wise or medical history-wise. I don't think anyone wanted to get sick, but the idea was we don't want people out there that are at high risk. And so I wasn't in the high risk category. And also willingness. I was willing, and I told the executive team early on, I'm willing to work. I want to see emergency patients. I want to make sure people are taken care of. So they allowed me to stay open, where if I was a solo practitioner, and I know this because I have a lot of friends from dental school that they closed down. They didn't have the resources to be able to drop their revenue that much and still pay their employees. But we were able to do that by selectively choosing which offices stayed open. And so that was really nice. And then during the whole thing, this was a really big deal. When it first started, no one knew what this was. No one knew how it was going to affect us. No one knew what the protocol should be. And so I would get emails from the board of dentistry, from the governor's office, all these things, because I'm, on their list of healthcare providers. excuse me there. And then, to try to sort through all that and understand, okay, what is this actually talking about? Let alone all the stimulus packages and all the other benefits the government was trying to roll out. It was overwhelming to try to read through that, knowing, okay, well, don't go to work today and do something that you're not supposed to do. And then, someone from the health department shows up and shuts you down. And so right from the get-go, our leadership team, they were going through this and reading it and making sure and making phone calls to the board, getting confirmation. Dr. Schuler, our regional president, I mean, he was on top of it. He was calling the board. He was calling everybody to make sure, okay, let's get some clarification on this. What does this mean? What do we need to do? And then that was then passed on to us as providers. And so, I don't want to say I didn't pay attention to those emails, but I knew that I didn't have to completely understand everything that I was reading to the T, because I was going to get an update. And in the beginning, it was literally the next day. Email would come out the next day. We'd get some sort of email communication. And then at least once a week, and in the beginning, sometimes twice a week, we'd have a Zoom call or a group call like we're doing,
Right.
With updates. And Dr. Schuler would say, okay, everyone, this is what, has come down. This is what it means. This is how we're going to change the protocols. And so, I mean, the amount of support that gave to me was phenomenal. I really couldn't imagine on my own trying to deal with that. And I guarantee if I had been a solo practitioner, I would have to close down, let alone the personal protective equipment, all of the other supplies that were extra that we needed, that as an individual, I could not have possibly gone out and acquired. We had full-time people whose only job during the shutdown was to go around and find PPE for the whole group. And, economies of scale being what they are, if you're looking for a amount of, some masks that a manufacturer someone has, if you need to buy only 100 masks, you might not have the ability to get that.
Right.
Whereas if you're going and buying thousands of masks, then we could buy it in large quantities, and then it was distributed to the office that needed it. They also were able to take PPE and other supplies from offices that were temporarily furloughed. And so we were able to shift our resources, even locally, things we already had. So they went into all the practices, okay, who's got what? This practice is closed down for a few weeks. Let's use that over here. And so there was a huge amount of support and just maximizing the resources of the group to make sure we were able to keep seeing patients. And so, I mean, without a doubt, there was no way I could have stayed open had it not been part of the group. And I don't know many private practices or any personally that actually did stay open during that time, because it just wasn't financially or logistically feasible to do it, where I felt very supported.
So let's talk a little bit about the team. We were talking a little bit about how they supported you as a clinician, but what about the rest of the team? I mean, there's all sorts of interesting dynamics right now with clinical staff, not the dentist necessarily, but the hygienists and the assistants.
Yeah.
And then of course the office managers, the non-clinical staff. How during the crisis, what was the communication like? What for maybe the practices that were furloughed, what was going on over there? If you could talk a little bit about that, and then for your office that was open during the shutdown, talk a little bit about your staff and did you have any that were a little apprehensive to come in?
We didn't, but I know that there were others who did, and everyone was given the choice. If there were people, for example, if one of my dental assistants had been, I don't want to work, I'm worried about this, I'm high risk, then they gave the opportunity to those from furloughed offices to fill that position. That didn't happen at my office, but I know it did happen at other offices where no one was ever told they had to work during it. And that was I really appreciated that up front. They gave everybody that option. If you don't feel comfortable, if you're high risk, if you have high risk people at home, then by all means, let us know and we'll make sure you're taken care of. As far as communication goes, I mentioned we had, group meetings and Zoom calls and things like that. And so did each position. So they didn't do it as frequently as they did for the doctors, were at least once a week. But they had periodic calls where everyone would get together, all the dental assistants, all the practice managers, all the hygienists, to give them updates. My hygienists, even though we stayed open, the hygiene was off the books. You couldn't do it. So they were furloughed. And so not only did the company do meetings with them, but we tried to do our office just as a little group. We reached out to the hygienists and made sure they were, how's everything going? Are you losing your mind yet? How are you keeping yourself busy? Those types of things, just to make sure there was that feeling that you were still part of the group. One of the beautiful things that I think that the company did is they gave an extra 2 weeks of paid time off to the people. Because in the beginning, we didn't know how long the shutdown was going to last.
Right.
And in Louisville, the heavy restrictions lasted, I think, about 5 weeks. end of March through till about May the 10th or so, we started bringing offices back online. We didn't bring them all back at once, but we kind of phased them in as it went along. And so that extra 2 weeks that they were able to use, plus the benefits that came from the government, helped a lot of people financially, where we didn't have to lay people off. We didn't have to terminate their position. They were able to be furloughed and just stay home and use those benefits as they chose to. Some people didn't use them, and they saved them up to be able to use them later in the year. But a lot of people did because, financially, if they weren't working, then that was a challenge. For my office, we were able to, have daily updates from our at the beginning of the day, we have a morning meeting, and we could say, okay, this is what's the new protocol for today. That's what we need to do, that type of thing. So those who were working got that all the time. And then those who were furloughed, they got at least once a week some sort of an update, whether it was a video call or an email or something, to tell them how things were going, when it was expected to, change, and just updates like that. The weekly doctor call was really important because, again, 2/3 of our providers were not working. And so that was a forum for them to ask questions. How is the PPE working? What is it like to work in an N95 mask? And for those of us who were working, we were on that call and able to say, it's not a lot of fun, but, about a week after you do it, you start breathing again and not wanting to pass out. And, that type of thing. And so there was that type of communication between those working and those not working so they could feel part of the group still. So I really appreciate there was a lot of communication and a lot of trying to keep people updated with what we knew, because it was constantly changing. But every level, whether it was the dental assistant, the hygienist, the practice managers, our business associates, they all had some sort of individualized communication from time to time from the leadership team to update them, to tell them what to expect. And then right before we started bringing offices back online, we actually brought them into the office for a 2-hour reorientation for those who had not been working, of, okay, this is what it looks like now to practice in this new setting, because they hadn't been doing it, and they were able to ask questions and kind of get up to speed with what they needed to do. And largely that information came from those practices that were already operating, the things we'd found out, the things that they had changed, that type of thing.
Yeah, it's great insight, and I'll point this out. A lot of people that are listening or watching this podcast may have seen it, but we early on in March we did a podcast with Mortenson, and you all as a DSO had been really close to the ground in China, following what was happening there way back when in January, and had put in contingency plans as far back as January and February, just in case. And unfortunately, it came to the United States. But it was really interesting to have that conversation and then listen to that podcast now. And, other groups, others, certainly solos, didn't necessarily have the insight to kind of take a look and be in communication with people in Europe and in China to see really how it was affecting them, and how the shutdown, and looking at virtually every single practice had been, or at least from a patient standpoint, it went from, if we were looking at, $1 million in revenue, it was 1% of that at a certain time. So there were some interesting contingency plans. So that's great. So we talked about we talked as a clinician, and we talked about the team. Let's talk about the patients. So what was it like? How did Mortenson handle patient communication during the shutdown? You talked a little bit about some practices being shut down and almost being any emergency being funneled into your practice.
Yeah, that's right.
So let's talk a little, how did that all work?
So we have lots of different methods to communicate with our patients, as I'm sure a lot of other people do. Text message, email, phone calls were the primary way we tried to alert patients. We had to, our schedule is typically booked out 3-4 weeks at least. So when it shut down, we had to go through that list, and all the practices, whether they stayed open or not, had to go through every patient and call them, in addition to emails and text messages, to tell them, look, if this is non-emergent care, we're not able to see you. And so we kept a rolling about 4 weeks ahead of the schedule, because the hygiene patients are scheduled out 6 months, 4 weeks ahead of the schedule, to make sure they were alerted that, look, we're probably gonna have to reschedule, that type of thing. We didn't go the full because we didn't know how long it was going to last. So about 4 weeks rolling ahead, we continued to call patients and get them pushed back, or just take them off the schedule and say, well, we'll reach out to you when that shuts down. So that's how it worked for our patients. We had a lot of our business associates and our practice managers just going through the schedules at all the offices, alerting people. A lot of people already knew just because of the news and things like that. I mean, they'd heard that the governor was shutting down non-essential care. So a lot of them were already on board with that. And they actually responded really well to it. They weren't upset. They understood completely. Once we were working, though, what would happen is if people called into any one of our offices, as you said, they were funneled to whatever the closest Mortenson office was. And the interesting thing was, when I was seeing emergency patients for about those 5 weeks, probably 4/5 out of the patients I saw were not Mortenson patients. They were patients from other groups in town or other practices in town that were not open. And you know, I've told this to a few patients since I've been back. The dentist isn't everybody's favorite place to be. You know, we get told all the time, you know, I'm scared of the dentist. This isn't my favorite place to be. I've never felt more appreciated as a provider than during the shutdown. Everyone who came through the doors they had to be in pain or they didn't come through the doors. Right. So these were people who, if they couldn't come see us, they weren't going to be seen, because an emergency room, they do their best, but they're not able to deal with dental emergencies very well, other than here's some pain medicine and antibiotics, see you later type of thing. And so everyone who came through the doors, our patients, other patients, were so grateful. And I think there was a general sense in the country of gratitude for healthcare workers more than we've seen in the past, because of the risk we put ourselves at being exposed to this virus potentially. And so they were incredible. I mean, I felt like a king walking around the office. Everyone was like, oh, thank you so much for seeing us. We don't care how long we have to wait. We're happy that you're here. Thank you so much for being open, that type of thing. And so our central patient services was able to funnel those people from whatever number that they happened to reach, you know, individual practices or a central number, to funnel them to an office that was open during hours that worked for them. And so that was just seamless. I didn't have to worry about that at all. My schedule was chock full every single day that I was open with patients. And it tended to go, one day I would see all limited exams, you know, I'm diagnosing all of these things. And then the next day I was doing treatment. It seemed to alternate that way, because my schedule would fill up so quickly that one day I'd just be diagnosing and doing, you know, care we could do that day, we would do it. But generally speaking, it was one day was diagnosing, the next day was heavily involved in emergency treatment, and kind of back and forth as the time allowed. And I think it worked very well. Another advantage was, if we did see a patient, for example, as I mentioned, the 2 other offices closest to me closed down. So I agreed to take their call. So any of their patients that came in, I would see them. And I was able to reach out to their dentist on the phone, because I know them personally. I was able to get into their charts through our computer system to see, okay, well, what's the last thing this patient had done? What did their x-rays look like 6 months ago? Now, for patients outside of our group, obviously I wasn't able to do that. But for those who came in that were from other practices, that centralized support and IT system that we have allowed me to get into their individual charts, talk to their individual provider, even though they were furloughed, to make sure we took good care of them. And that happened on quite a few occasions where I had to consult with their dentist saying, hey, this is what's happened. You know, I can slap a quick fix on it, or would you want me to take care of this permanently while they're here, so you don't have to worry about it when you get back? And, oh yeah, go ahead, do that. That sounds great. Thank you. And it gave the patient peace of mind knowing that I had personally spoken to their dentist at their practice. And so that was a huge advantage. And quite a few patients who were really apprehensive about going somewhere different, you know, they'd seen their dentist for 10, 15 years. It was good for them to know that I personally called them on the phone and said, hey, this is what's happening. This is what we're going to do. And they said, yeah, go ahead, give them the green light. And then, you know, we had a lot of patients who, that just made them feel really good about the fact that we consulted together. And the group was what allowed us to do that.
Well, it's interesting. So you mentioned that some of the Mortenson practices were temporarily shut down and everything was funneled through you. But you also talked about this. We talked about this before we started to record. That there were plenty of docs that were not part of Mortenson that also were shut down completely, and some that still are.
Still are.
Is that correct?
That's correct.
So this is a little off topic, but I really want to make sure I don't forget to ask this. So, you know, we're kind of I don't know if we're coming out of COVID. I'm not going to say that because I don't want to jinx anything, but things, you know, it's certainly the new normal, whatever you want to call it. Mostly everything's opening back up, but there are still practices in the local area anyway that have not reopened, and
That's right.
you're getting some of those patients that are now in need of, whether it's just hygiene or whether they have emergency care, that are reaching out because their doc has not opened back up. And you said even in some cases they're calling and there's nobody answering the phones.
That's right. Yeah, I had a patient this week that said, I keep waiting for them to open their doors. They haven't opened their doors. So I drive by this office, and so I thought I'd come in here and see you guys because at least you're open.
Yeah.
And they had no ill will towards them. They completely understood, but they needed care still.
Sure.
And I've had a few cases I've taken over in the middle of quite advanced treatment that, we're trying to get it, call my dentist. Well, they're not open, and so we've had to take over and obviously complete it the best we can. And everyone's been very understanding because of it's not like it's a localized situation to that practice. It's everybody going through this together. But yeah, we've had quite a few patients come over, not because they were dissatisfied, not because, they didn't like their dentist, but they're just not open. And they wait. I mean, we're 5 months, 6 months into this. And so by any stretch of the imagination, they can't just keep waiting for routine care.
Sure.
Or even emergent care because they need someone to take care of them. And so, I can't speak for other practices, but I know I've gotten a lot of patients like that over the last few months coming in just because we waited as long as we can, and I guess we're going to come over here now. And
Yep.
we're obviously happy to receive them.
Sure. Yeah. It's a lot of speculation about, once this all is said and done, how many practices won't reopen, but it certainly sounds like there are some that might not, at least in, your local area. And I can't imagine that's not across the country at some point.
Yeah.
And kind of gets back to the point of this whole podcast is, the support of a DSO and being able to procure the PPE and things like that, and having the management behind you and being able to handle the phone calls and emergent versus, non-essential care. So, really, really interesting phenomenon that's occurring. So a couple other things. During when the dental restrictions were in place, was there like one big concern that you personally had, and how was, Mortenson able to kind of handle that? I mean, I know you probably had a lot, but was there anything that really stood out?
So me personally, I don't know, just the way my brain's work. I was never really afraid of getting sick or things like that. To me, being in healthcare, we take standard precautions, so it wasn't that. It was more with the ever-changing restrictions and do this, don't do that. How do you communicate that to patients, to staff members who may be afraid of that? And most of them were,
Sure.
and who don't necessarily have as much understanding about how, the body works and viruses and that type of thing, where there was a lot of fear. There was a lot of, what's going to happen? This is really scary. Do we want to come in to get treatment done? So as far as patients go and the staff members, are we going to catch this? And then also, are we doing the best things to make them feel better? So there's all this fear, there's all this uncertainty. Let's make sure we have the right protocols in place for them to feel comfortable. And I was worried, okay, are we going to be doing enough? Are we going to do the right things? Are we going to be doing the things the governor's office wants us to do? That was what I was worried about. Again, trying to treat all these patients while trying to interpret and roll with this, type of thing. And that was my biggest concern was, one, we'd have patients scared out of their minds, two, employees, and three, we don't want to do something wrong that could then get us in trouble because we did something that was not according to protocol. And, so that was my biggest fear. And again, we've kind of mentioned that a little bit with the updates, but a specific example, we reached out to the governor's office and the Board of Dentistry with all of their restrictions and said, okay, here's a list. Can we do this? Can we not do this? And so they actually sent to the providers a cheat sheet, if you will. And of course, it always says use your clinical judgment. The individual provider needs to make a final call. But it said, here's some examples of things you could do. Here's some things you shouldn't probably do based on what we understand. So that was on my desk very early on. And so when a phone call would come in or a patient would come in, I said, okay, well, is this something that falls within the criteria or not? And that changed as we got more clarification. Right. So at first, we were very strict. Like, if you were not dying in pain, you did not walk through the door because we didn't want to be doing, spreading this virus or doing things we shouldn't be doing. And then as we got clarification, that was updated. And so that sheet changed and updated until we knew. So there was always this reassurance for me that things are okay. We know what we're doing. We're doing best practices. This is the most current guidelines. And another example, we had, when they first came in, they were telling everybody, and this was pretty much nationwide, I think, but at least in our group, everybody needs to be rinsing with 1% hydrogen peroxide solution before you do anything. So that was protocol. Okay, we're doing that.
Right.
And then after a few weeks, they're like, actually, the research is now showing that that's probably not necessary. So they said, stop doing it. Okay, we stopped doing it. And so, things like that on my own, there's no way I would have been able to look that up and see. At least I didn't want to take the time to do that type of thing every night. And so they were constantly updating. So I felt very comfortable communicating to patients that, look, what we know is this. These are the proper protocols. We're doing everything the governor's asking us to do because of that support system behind us. And it was good for the patients, but also for the employees and the team members to know we're doing everything that's the most current. And as I mentioned before, if they did feel uncomfortable, we'll find somebody else that's willing to work, and you don't have to. And so, I think being part of the group, the support led right into that idea of I didn't need to worry about that as much. Now, individual people still were really scared, and we had to, reassure them and give them as much information as we could that yes, we're taking precautions, and yes, this is important that you're here because you're swollen and you're in pain. And if we don't do something about this, then you're going to be in a much worse position. And so that, individually, we had to work through things on an individual basis. But as a whole, it was nice to know, here's the protocols, this is what you need to do. We've been talking with the governor's office, we've been talking with the Board of Dentistry, and we are up to date with the current recommendations. So if you implement this, you're doing what you're supposed to do.
Excellent. So we have a lot of solo practitioners, whether they own a practice or whether maybe they're relatively new out of dental school, don't own a practice, but are toying with the idea of either working for a DSO or affiliating, selling their practice to a DSO. What questions should they be asking? What should they expect? Tell us a little, because you didn't have a practice, but you kind of probably had some of the same thoughts. You've heard some things that might not have been necessarily positive about DSOs when you were in dental school. So tell us a little bit about your thought process back then, and then maybe just now that you're on the other side, 11 years in, kind of what that experience is like. What just so they're because I think that we get a lot of folks that come to us that are again clinicians that are kind of kicking around the idea, but don't necessarily even know where to start, what questions to ask, what to look for.
Yeah, that's a great question. I think it is the crux of why not only I came to Mortenson Family Dental and now Mortenson Dental Partners, but why I've stayed. Because I heard the same things, don't work for the groups, and they'll take advantage of you. And without naming names, I had a job offer from another group right out of dental school before I had chosen to join Mortenson Family Dental. And then I talked to before I joined, as I mentioned, I knew a lot of the Mortensons already. I talked to some of their practicing, and they said, this is great. They don't step on my toes. They don't interfere too much, and I get to roll. That being said, as you mentioned, I've never had my own, individual solo practitioner practice. So I was able to seamlessly come into the group, and this was just how it was, right? And so I kind of fell in, and I've never felt micromanaged. I've never felt that ever anyone came to my office and said, this month you need to do this many crowns, this month you need to do this many root canals. That has never happened. And if it ever did happen, I would leave. But I know it won't, because of the way that the group is set up, where it's managed by dentists, it's owned by dentists, that type of thing. But that does happen in other groups. And so I would say to them, the devil is in the details. You need to find out not only what they tell you, but speak to their practitioner, speak to them privately, go out to lunch, go out to dinner with them, say, hey, what's the deal? Is this, and I've had those conversations with other people joining our group, where the executive team said, hey, call Dr. Brown, go out to lunch with him, ask him. And I'll tell them candidly the pros, the cons, all of those things, and let them decide. But it is the devil's in the details. Not all group dentistry is created equally. And one of our slogans at Mortenson Dental Partners is that we're the next generation of private practice. And I really believe that. I really believe that we're much more of a group that works together for the collective whole than we are an ownership company that employs dentists. And I really feel that strongly. And so I know there's probably other groups like us out there. I can't speak to them. I know Mortenson Dental Partners tries their best to do that, to give the autonomy where the autonomy. Now, that being said, there's still, I can use the dental materials I want, but there is a select things that we have special deals with, certain companies that we have deals with that says, if you order this, you're going to get a slight discount. it behooves me to use products that are a little less expensive because, but if I don't like that product or I have another product that I want, I can still order that. They're not going to come in and say, you can't order that. Now they are going to say, you need to run your practice. You can't have your costs out of control. They're going to give you advice on revenue. They're going to give you advice on production, on people costs, all of those things. Every month, they're going to review that with you and say, look, here's where you have some opportunities to improve, but they're not going to come and tell me how I have to improve that. They're just going to say, look, we want to take care of the patients. Here's an area you can improve on. So there have been some people who've worked for us that don't want to be told anything. But to me, why am I in a group if I'm not going to listen to people who know a lot more about those types of business things than I do? And so I never take it as them trying to control me. They're trying to say, we want to be successful. We want you to be successful. Here's some advice on how that can be. And I really feel that it is the next generation of private practice in the sense that my individual office, there are lots of similarities with all the other groups, branding and things like that. But my patients come to me and they still feel like they're seeing Dr. Brown. And I moved locations 3 years ago to my current location from another group with a different part of town. And I had quite a few patients who followed me over because they liked Dr. Brown. They had nothing against the other dentists at the other practice, but they had been seeing me for 8 years and they wanted to follow me. And they were allowed to do that. They came over to my practice and, because we were just a few miles down the road, and I still see those patients. And so there's very much that feeling of this is my office, but it's supported by the greater whole. And I don't think that that's true of all of the groups out there. And so really looking into those details about, one, how much autonomy do you have clinically? I feel that the provider should have all the autonomy clinically as long as they're practicing within the standards of care, obviously. There's always oversight. If you start doing things that you're not supposed to be doing, the group's going to come in and say, hey, we need to have a conversation. But if you're practicing within the normal scope of the standard, practices, then they're not going to say anything. They want you to take care of your patients the way they want to. So I provide a lot of advanced type of dental care, but other people don't. They don't feel comfortable doing sedation dentistry or implant dentistry. They're not forced to do that. They can do what they feel comfortable with. But if they want to do that, they have the support of the group to say, well, let's get you the continuing education you need. Let's get you, the equipment that you need to do those procedures. So, it's a huge benefit. And I personally have loved it in the sense that I feel the support, but I don't feel micromanaged. And I've never felt that clinically they're stepping in saying, you have to do this, you have to do that, or else. And I know people who've worked for other groups that they have been told that. You're not doing enough crowns, you need to do more crowns. You're not doing enough this, you need to do more of that. And to me, that's not a good thing when we start making decisions based on just numbers, not on what a patient actually needs. And so the last thing I would advise people who are looking at DSOs and groups is what's your opportunity to have ownership in the company? Because the trade-off with having them provide a practice for me and the equipment is obviously they need to have some sort of return on investment. And so they're going to reward the people who have spent the money, the owners of the company, to invest in this, location. And so if you're never given an opportunity to buy into the practice or to buy into the group, then I feel like financially, you're never going to achieve the same level that you could have as a solo practitioner. Doesn't mean you would have as a solo practitioner, but that you could have through that ownership option. And so Mortenson Dental Partners, and, before it was at Mortenson Family Dental, after my first year, I qualified to be able to buy into the company. And so I did, and I've continued to do that every time there's been a capital call. I'll put money in to continue to buy more ownership. And then we have our employee stock option plan, which is like our retirement plan that everyone, from my assistants to my business associates to my practice manager, they're all given each year a certain amount put into this retirement account, which is ownership in the company. And actually the single number one largest owner of our entire group are the employees. The ESOP owns the most percentage of the company. And so it really is not only the dentist, but also the people working for us. And that's very rare. And I don't even know if there are any other DSOs that offer that, without question, you're going to become an owner. And then in addition, for our providers, the dentists, if they want to, they can buy stock, whether in the whole or in their local region as one of the partners. And so ownership and then autonomy, to me, those are the two biggest things you need to look for in a DSO or a group, because if you don't have those two, you're not going to be happy for very long. And if you're not happy, you're going to leave. But there are groups out there like ours that don't do that, that their goal is to bring you on, make you part of the team, and give you a long-term career.
So autonomy and ownership.
Amen. That's it. Autonomy and ownership.
And to your point about ESOP, I think you are one of the few. I'm sure there may be a couple others out there.
We all get ESOP, dentists and everybody alike, whether you invest or not. That's just given to you at the end of the year, which is kind of nice.
That's excellent.
And I'll tell you one thing, it's great, not only great for retention, but it helps you feel like you're a part of it. It's not just me working at this office, but, I have fractional ownership in the group. And so I have a vested interest in staying and also treating patients well so that we do well financially.
Right. Yeah, makes a lot of sense. So we have time for one last question, Dr. Brown. So let's talk a little bit about just in general, any experiences, anything else you want to share, whether it's pandemic related, whether it's not pandemic related, and then we'll let you go. But this has been great.
Yeah. The number one thing, and my wife she posted my written interview that we did before on Facebook yesterday, and she put a little tag in there, and I think it was, really nice. This idea that through the 11 years, there have been ups and downs and good years and bad years and that type of thing, just, whatever it might be. And I've always stuck with the group because in the end, it's the support. Is there an opportunity to be a solo practitioner and do very well financially? Yes, there is. But then I think COVID, the one thing it's really driven home more than anything else is that, when the sun's shining, it's easy to make hay for everyone. But when hard times come, solo practitioner, you're on your own. And that doesn't mean you'll sink, but it just means you're on your own. And so you have to do all those things yourself. This experience, as much as I haven't liked COVID, my work experience has actually, and I kind of mentioned this earlier, been probably the most fulfilling time of my career, both from being able to see emergency patients and the gratitude that I felt as a healthcare worker, not just at the office. I started wearing scrubs again because I used to wear nice business casual clothes, and we don't want COVID all over that. So I went back to wearing scrubs, and most of our dentists did that when this started. So, we can take them off at the practice, wash them there. You don't have to bring anything home to your family. But I'll go to work in my scrubs. If I stop by the gas station, oh, you're a healthcare provider, this is free. Don't worry about it. Your drink's free, that type of thing. Just that general feeling of gratitude for healthcare workers. But in addition to that, the gratitude I feel for the group to support me through this time. I was fortunate, and I realize not everyone was fortunate to be able to work, but I continued to have income this entire time. Not all of our providers did. And so they did face some financial hardships, but the company also gave them great advice of what they could do. They even did a little email about, hey, this is what you can do with your 401k. There's a way you can take out a hardship loan and pay it back. Information that any of us have access to, right? But I had no idea about any of that.
Right. It's a maze for sure.
Yeah. And so they said
that on your own.
They came out with a whole financial assistance advice package that they emailed to everybody saying, here's a few things you can do if you need help financially through this crisis. There's a loan you can get, there's this you can get. And so just that feeling of support. And so there's ups, there's downs, like I said, to anything. But this experience has cemented in my mind the huge advantage of working for a group because of that support that you just wouldn't get otherwise. And so my wife had mentioned, we've always been kind of committed to the company, but we're more committed now than we've ever been because of how we've seen, regardless if we agree with how the world's reacting to this or not, it's happening. Right. And there's lots of stuff going on. There's people scared, but I've never felt at any point that my employment was at risk, or that financially my family would be ruined by this because of being part of the group. And I would not be sleeping as well at night, I think, if I was a solo practitioner during this. And this will pass, but there will be other crises. There will be other problems. There will be changes. And how will you weather each one? To me, it just gives me peace of mind knowing, they've got my back, and, we've got a great relationship working together. And it just gives me a lot of peace of mind. And so that would be my one final thing to say is just, for those who are considering it, the devil's in the details. Make sure you ask, what type of group you're joining. But it's so comforting. And I think back to kind of what I mentioned earlier when I was in dental school and I worked with this other group, and it was a great group. And that dentist that had done it for 10 or 15 years on his own, and, he did okay, but he just said, my life is so much happier since I've given away all of that headache to let someone else manage for me. And I just treat my patients now. And so this COVID crisis has really re-cemented that and recommitted me to being very, very happy where I'm at and being, part of the group. So it's a great thing, and other people should really consider it.
Excellent. Well, that's a great way to end this podcast. So thank you, Dr. Blair Brown from Mortenson Family Dental, part of Mortenson Dental Partners. I think I got that right.
Yeah, that's right.
Yep. So thanks for your time. And really, I think we went through a lot in a short amount of time, whether it was COVID related, whether it's just, hey, why should I consider joining a DSO? I mean, you talked about autonomy, you talked about equity ownership, those types of things, getting rid of the headaches. But really, really nice to hear that things are going well, especially for Mortenson. Sounds like you guys are, and again, one thing we forgot to mention was you said that, was it May and June or June and July were some of the
June and
biggest?
July are the busiest months of my career.
Yeah.
My personal production, the two highest months of my entire career, because of the backlog that people, whether they're new patients or whether it's our patients who weren't able to be seen, have come back in. To me, that shows there's confidence from our patients that we're doing things right.
Absolutely. Well, great stuff. So thanks again, Dr. Brown. And thank you everyone for watching and listening. I'm Bill Newman from the Group Dentistry Now Show. Until next time.
The Group Dentistry Now Show has listeners across North and South America, Europe, Asia, and Australia. If you like our show, subscribe today and please tell your colleagues about us.